Hi there, Courtney here with Sjogren's Girls Guide, and though I'm not a doctor, I do consider myself a professional patient. After a few of my favorite pages on Instagram posted about not wearing underwear, and the comment sections were like, wait, what? We can do that? I realized we should probably be talking a little bit more openly about vaginal health. Because I used to be that girl, the one who thought something was wrong with me because I couldn't make it through the day without that deep, stinging, itching, burning feeling that was like fire ants in my underwear. And I lived with that feeling every single day for 6 years. Doctors kept saying everything looks fine, but it wasn't. And once I finally got diagnosed with Sjogren's at age 31, my OB sat me down and told me some things I wish I had known a decade earlier. So I'm passing them on because no one should have to learn this stuff the hard way. Number 1, your vagina is self-cleaning. You don't need floral wash, foam, or anything labeled feminine. In fact, the fragrance is one of the biggest triggers for irritation, especially if you're already inflamed. The American College of OBGYN recommends just warm water for cleaning, maybe a little unscented soap, but on the outside only. That's it. The more you mess with it, the worse it'll feel. You just need to leave her alone. Number 2. pH actually matters. A healthy vaginal pH is between 3.8 and 4.5. That acidic environment is there for a reason, and it helps prevent infections. But pH gets thrown off all the time by antibiotics, semen, lube, tight or synthetic underwear, stress, and yes, autoimmune flares. When that balance shifts, you'll feel it. Burning, discharge, irritation, and odor. The one thing that has really helped me, that was recommended to me by my OB, a baking soda soak. Take 1 tablespoon of baking soda in lukewarm water and sit for about 10 to 15 minutes. It won't fix everything, but it can help calm the pH without totally wiping out your natural vaginal microbiome. Number 3. You don't have to shave. Pubic hair is protective. It's not dirty, it's there to help. Shaving increases friction, inflammation, and your risk of infection. But if you do shave, go with the grain, use a clean razor, and skip the drugstore foam. Instead, try coconut oil or sweet almond oil. They're way gentler and naturally antimicrobial, and can also be used as a natural lubricant as well. Studies show that shaving increases the risk of BV, UTIs, and even STIs because of the tiny cuts that let bacteria in. So if you're skipping it, good for you, you're protecting yourself. Number 4, diflucan is not a one-size-fits-all. Fluconazole only works on the most common type of yeast. But if you've got an uncommon strain of yeast, which is more common in people with autoimmune disease, diflucan will not touch it. If your infections keep coming back, ask for a culture. You might need terbinafine, topical meds, or a boric acid treatment instead. You're not overreacting, you're asking the right questions. And number 5, you actually don't have to wear underwear. I know some of you just clutched your pearls, but listen, your vagina is not meant to be wrapped in synthetic fabric all day, every day, especially if you're dealing with chronic irritation, burning, or recurrent infections. Here's the deal. Wearing tight, non-breathable underwear, especially overnight, can trap heat and moisture, and that creates the perfect environment for yeast and bacteria. If you can go without underwear while you sleep, do it. If you can go out without underwear during the day, do it. That's literally one of the first things my OB told me after diagnosing me with Sjogren's, and it has made a huge difference. If you have to wear underwear, make sure it's 100% cottons. Sorry girls, no lace, no polyester blends. Cotton lets your skin breathe and helps absorb moisture without locking it in. Letting things breathe down there isn't dirty. It's smart, it's preventative, and in many cases, it's a thing that no one tells you might finally help you feel better. I've lived with vaginal pain, itching, and burning for years. Every day, my discomfort, people and doctors just brush off as normal, but it wasn't normal, and it sure as hell was not in my head. Please comment real if you've been here too, and I'll meet you in the comments because you deserve answers, you deserve relief, and you deserve to feel at home in your body again.